Hello, I'm Dr. Rhonda Johnson. Today is Wednesday, May 1st, 2024. First, I have a trigger warning. Today, I'm talking about sexually transmitted infections from oral sex. So, folks, if you don't want to hear this message, please keep scrolling. So, STI Awareness Month was in April. However, rates of STIs in young people continue to skyrocket. So, I don't think it matters if I missed April by a day. So here's a startling fact. According to the CDC, 50% of all STIs in the United States occur in young people ages 15 to 24. Now, I am retired from clinical practice, but for over 20 years, I took care of adolescents and young adults with sexually transmitted infections, including oral sex-related STIs. And one of the most common myths that I would hear from my patients was that they thought that oral sex was safer than vaginal or anal sex. So people are really misinformed about the risk from STIs from oral sex, and I'm here to talk about that. So first of all, what STIs can you get from unprotected oral sex? Well, HIV, the virus that causes AIDS, herpes simplex virus, HPV, human papillomavirus causes warts, genital warts, chlamydia, syphilis, gonorrhea, HBV, hepatitis B, Mpox, formerly known as monkeypox. All of these can be transmitted through oral sex. So what are the symptoms of oral STIs? Well, you can have either painless or painful sores in the mouth, sore throat, trouble swallowing, swollen tonsils, swollen lymph nodes in the neck, redness or white spots on the tongue or throat, and blisters in and around the mouth. So what are the top risk factors for acquiring any STI? Number 1 is unprotected sex. Number 2 is being under 25 years of age. Also being under the influence of alcohol or drugs, having multiple sex partners, exchanging sex for housing, drugs, money, etc. So basically, anyone who has had unprotected oral sex in the past 12 months should get tested for STIs. Now, what about testing and treatment? All STIs can be diagnosed and treated. Most can be cured. Some can be prevented by vaccines. Now, some STIs can cause multiple reinfections, especially chlamydia and gonorrhea. So oftentimes the young people that I treated had advanced STIs. And STIs can cause a lot of complications if untreated. Now, we know that young people are often afraid to talk to their parents. They're afraid to talk to the healthcare providers and tell them that they have been sexually active. And they don't disclose information about their sexuality either during routine healthcare provider visits for many reasons. So this is what I am trying to do, bring this topic out into the open. Sometimes young people don't have their own money for tests and treatments. Again, I recognize this is not an easy subject, but STIs will not go away just because they are hard to talk about. And we know that many schools no longer offer sex education. Many schools don't have school-based health centers, so this topic may not be talked about in the educational venues that your child may be participating in. Now, the CDC offers free guidance on where you can get free STI testing. Go to the website, gettested.cdc.gov, gettested.cdc.gov. And I hope that this message will make it easier for parents of teens to have a discussion or young adults to share this message with other people. And remember, no matter what your age, if you are sexually active, you should get tested. That's my message today. I'll include the link to the cdc.gov website for additional information. Take care, folks.